Hi, my name is Lisette Rios, and today's presentation is going to be about energy drinks and cardiovascular health. Now we're going to explore the correlation and the risk found between the energy drinks and the cardiovascular health. So let's get into it. Throughout this presentation, there's going to be 3 research questions that we're going to be answering. So the first one is a pretty basic, broad question. What is the relationship between energy drinks and cardiovascular health? This will help us dive into the second and the third question. Our second question is, what are the populations most at risk of fatal cardiovascular outcomes due to energy drink consumptions? So what age groups or what field do they work in, or what is their preference? What makes them more susceptible to the cardiovascular outcomes from energy drinks? Now, our third question is, what actions or alternatives can be implemented to lessen the negative impact of energy drinks on health? So what changes can we make, or what can we avoid in order for those energy drinks to not be affecting us in our cardiovascular health? This slide is going to serve as a form of introduction. We're going to talk about why this topic is important. Why has it arisen nowadays? Why is it so important and prevalent in today's society? Well, recently, energy drinks have become super popular, but because of its popularity, some concerns have started to rise, particularly in our cardiovascular health. For example, could people start developing artery disease, high blood pressure, or could it even go into cardiac arrest? How are these energy drinks that are super popular affecting our heart health? So that's why it's so important. It's going to shed some light on some new information on how it's affecting our health and what are some potential risks associated with the consumption, whether it be you take the occasional drink or you drink these every single day. Especially amongst us younger generations, it's important to know what risks can come from these drinks. And just to highlight how important it is or how prevalent this has become, there's been companies that have implemented policies that are not allowing their employees to consume energy drinks, particularly while they're at work. So with new research coming out, it's really important to understand the short and long-term effects of energy drinks on our health. Therefore, I hope with this presentation, we can learn about these risks and make good decisions regarding our health. For the next few slides, we're going to be covering and answering question number 1. What is the relationship between energy drinks and cardiovascular health? Energy drinks have become popular in the US, and they've become considered functional drinks along with sports drinks such as Prime, Gatorade, Body Armor, Vitamin Water. Therefore, they're pretty accessible. You can just pick them off a shelf at a store. However, with this popularity, there's been some health concerns, and it's especially within the common ingredients actually found in the energy drinks. So there was a study done with the common ingredients in these energy drinks, and we're going to talk a little bit about it. Why was this a problem? Why was it seen as a concern? Well, this study actually examined 20 energy shots, 55 energy drinks, and they found a mean of 18.2 ingredients per product. Now, what were some common ingredients found? It was caffeine, B vitamins, and taurine. These were really prevalent in energy drinks, but the scary part was that some people that consume energy drinks are mega dosing, which means that they're consuming more of these ingredients that the recommended daily allowance requires, or this is what is allowed. We're consuming more than what we should be. Therefore, this is what's raising concern and why we should inform others about taking healthy decisions when drinking energy drinks, and maybe in place include some regulations to stop these mega doses. Talking about mega dosing, here in this chart we have a red dashed line, which is figuratively speaking the tolerable upper intake level of niacin. Now, if we note the plotted dots, there are some products that are containing more niacin, a B vitamin, than the tolerable upper intake level. Therefore, that's the dangers of megadosing when consuming an energy drink or an energy shot. Although the long-term effects of energy drinks remain unknown, there has been studies done on nowadays and how these energy drink consumptions have affected our cardiovascular issues. And to note, the FDA has attributed 34 deaths due to consuming energy drinks. Therefore, there have been safety investigations and concerns. There was also a study done on children and adolescents because the effects of caffeine from these energy drinks are also affecting their cardiovascular responses. For example, it is notable that boys had a greater cardiovascular response to the caffeine compared to the girls. However, there was an effect on the girls post-puberty when they're going through their menstrual cycles. Therefore, their gender and their age definitely affected how their body responds to caffeine, but hence it's still a safety concern. Now we're going to talk about question 2. What are the populations most at risk of fatal cardiovascular outcomes due to energy drink consumption? Who are these drinks more popular with? Well, for some background information, energy drinks started becoming popular in the 1960s, and since then their popularity has only gone up. But their target population has been young adults, especially those aged 18 to 34. And although these ages can be, for the most part, healthy, energy drink consumption adversely affects their cardiovascular parameters and their glucose metabolism. Therefore, even if you are a young, healthy adult, you should think twice before picking up that energy drink. Now, who else is at risk? Athletes, people who exercise, and tired students. Why is this? Well, energy drinks are consumed in sports or as tired college students or tired students for alertness and performance enhancement. Why? Because caffeine is the primary component of an energy drink, which is an ergogenic supplement, which increases your productivity, your work. So these stimulants may seem like they're working at the moment, but they may also cause adverse cardiac events during exercise. And the reason that we know that these adverse effects are real is because with a study done amongst exercising groups who consumed energy drinks, the results showed that the energy drink consumption delayed their heart rate recovery in both high and low cardiorespiratory capacity groups. Once again, there was another study done amongst patients aged 13 to 25. The people selling energy drinks are going to be targeting this young age group. However, we continue to see the adverse effects these drinks have on this younger generation. These people consuming the energy drinks had specific behavioral adverse effects. Therefore, it's not a positive effect. And lastly, we're going to go into our third question. What actions or alternatives can be implemented to lessen the negative impact of energy drinks on our cardiovascular health? In reality, most of us don't know much about energy drinks, but we do know what influenced us into consuming or purchasing these energy drinks. However, what interventions could we think of? Well, this is exactly what this study covered. It looked for young people's knowledge on consuming energy drinks, why they bought them, and what they thought that they could do to change. Now, what we learned is that they bought the energy drinks because it enhanced their energy, it had a pleasant taste, they're low cost, maybe peer pressure, and easy availability. Additionally, social media marketings, commercials, all of these promotions into buying the energy drinks were a factor into purchasing them. However, what interventions could be taken? Possibly changing packaging, increasing prices, reducing their visibility in the retail outlets, and research and education about the adverse effects that energy drinks can have on us. There is a correlation between energy consumption and poor dietary behaviors. For example, those students who were consuming energy drinks were also likely to not consume many fruits, vegetables, milk, or even breakfast. So they were skipping these crucial parts of our diets. So what's an alternative that can be taken to this? Well, preferably consuming healthier options, more servings of food, more servings of vegetables, more servings of milk, and not skipping a breakfast meal, and therefore slowly decreasing the consumption of energy drinks and possibly replacing these consumptions of energy drinks with simply water. You may ask yourself, could I replace consuming energy drinks with drinking a coffee? Well, not necessarily. The best option is probably just consuming water, because although coffee may seem like a good alternative, a study was done between the acute consumption of energy drinks, coffee, and water, and there was no significant difference in the cardiac QTc interval or other key hemodynamic and cardiac parameters. So coffee wouldn't be the best alternative to an energy drink. In fact, here's a chart showing us that there was no significant difference amongst a low-dose monster, a medium-dose monster, coffee, or water. Therefore, coffee is not a good alternative to the consumption of an energy drink. In conclusion, in recent years, energy drinks have gained a lot of popularity, especially amongst young people, because energy drinks can be considered a dietary supplement, and that's part of their popularity. There are common ingredients, including caffeine and taurine, which could boost your work effectiveness. However, there have been safety concerns due to adverse events, and because of this, when you go to the store and you see an energy drink on the shelf, maybe we should think twice about our cardiovascular health and what effect these energy drinks could have on our health